This is the injury report presented by NYU Langone Health. Yankees fans got some good news earlier this week when designated hitter Giancarlo Stanton was spotted taking on-field batting practice for the first time this season. Stanton has been on the injury list since the start of the season due to elbow injuries, and while he seems to be making progress, there's no set timeline for when he'll begin a rehab assignment. So let's bring in Dr. Michael Alaia, Sports Orthopedic Surgeon at NYU Langone Health, to discuss this injury and Stanton's recovery and when he might be back. So, Doctor, Stanton has been dealing with this tennis elbow in both elbows, which seems kind of crazy. What exactly does that mean, and how does that develop?
So essentially, it just means that he's suffering from the same problem on both arms at the same time, which is pretty rare for an orthopedic sports medicine practice to see that, but occasionally we can see it. It's certainly nothing that is dramatically awful by any means. It just means that he's battling the same problem on both arms. So essentially, tennis elbow, or the medical term would be lateral epicondylitis, means that the tendons on the outside of your elbow, so if I were to hold up my elbow like this, the tendons that are on the outside of the elbow right over here have developed either inflammation or small partial tears, which can be quite symptomatic. And those tendons that attach right there on the elbow are the tendons that allow you to bring your wrist up, also allow you to help open up your palm like that, what we call supination of your forearm. And for repetitive athletic motions, those tendons can become inflamed quite often, and we're seeing that with Giancarlo.
All right, so it does seem promising that he's been taking batting practice. Hopefully, he's kind of moving in the right direction. What kinds of things has he been doing while he's been away from the team to get better and make that recovery?
Well, I think the first thing in any process that's inflammatory in nature is to reduce the inflammation. So that's the first thing they're working on, getting rid of the pain, all right, making so average motions are not causing him too much discomfort. So whether that be through modalities or therapeutic exercises or simply anti-inflammatories, sometimes even a corticosteroid injection, the object is to get rid of the pain. Now, once the pain goes away, they start working more on a strengthening program to strengthen the muscles and the tendons in the area, work on dynamics, work on throwing mechanics to really make sure that he's feeling up to par for going back to full sport.
And Doctor, this is a guy who very much requires full use of both of his elbows in order to do his job. So is it possible that this could worsen? It could linger? Could he need surgery at some point?
So, with any kind of inflammatory process, there's always the possibility that this can linger for an extended period of time. Now, more than likely that's uneventful, or that's probably not going to happen. More than likely, he's going to get back to full activity and full sport in the near future. The natural history of this rather dictates that over 98 to 99% of the time, the patients will get better with a good course of conservative management and non-surgical care. In a very, very small subset of patients, they will require surgical management to make their symptoms go away. But for someone like Giancarlo, who's got access to the world's best physical therapy and the world's best modalities, it's a very, very low likelihood that this will escalate to surgery.
That's good news. That's what Yankees fans want to hear. I know, you're not his specific doctor, but in your mind, what would be the best and worst case scenario for when he could return to the lineup?
Well, I mean, the best case scenario is that he could return ASAP, and there's really no timetable on this. It depends on when the patient feels better or when the player feels better. So, best case scenario, he's back out taking batting practice, starting to throw short tosses, long tosses as soon as possible. Worst case scenario, this drags out, and most of the time, this is not going to be an extended period of time where they're out of play. Worst case scenario, maybe 2 or 3 months, but I would anticipate for him he's going to get back hopefully pretty quickly here.
That's more positive news. I mean, it is tough with baseball. They play so much. It's such a busy physical season. You can see maybe why they're holding off a little bit, but I'm sure, they want to get him back out there as soon as possible. So we kind of talked about this before, but is double tennis elbow, excuse me, something you often see in people who aren't professional athletes? And would their recovery differ at all than a professional athlete?
I think it just depends on what they have to do. A lot of patients that we see are athletes in some way, shape, or form, meaning they are people that are trying to get back to an active lifestyle, recreational baseball, hockey players, throwers, etc., or just average Joe trying to swing a tennis racket or a golf club. and everybody rehabilitates differently. There's really no rhyme or reason as to who's going to get better faster. And anecdotally, from my own practice and treating lots and lots of patients with this issue over the last 13 years of my career, I probably couldn't put a finger on exactly when and how people are going to get better, but the great majority of the time is that they do. And as I said before, thankfully for him, he's got access to the world's best physio. So every treatment option that's available to him is going to be there. And you know that you're going to have your trainers, your ATCs working on him day in and day out to get better. Because as you said, this is a guy that relies on both arms to hit, to throw, and baseball, they're playing every day. So we want to make sure that he's in tip-top shape before he's getting out there and stressing this every day.
Absolutely. Awesome. Lots of good stuff. Doctor, thank you so much for taking the time to join me this afternoon.
My pleasure.